All right, welcome everyone to the 2022 PI Conference. We will get started in just a moment. Spanish interpretation is available for this session, and you can access the Spanish language line by clicking on the world icon in your Zoom toolbar. My name is Emma Mertens, and I'm the Program Manager of Community Relations at IDF, and I will be your moderator for this education event. Today, Lynn Albizo and Christopher Duckett will be presenting on the topic of navigating the post-pandemic workplace. There will be time for questions at the end of Lynn and Chris's presentation. Please submit any questions you have for our presenters in the Zoom chat. Lynn H. Albizo is the Vice President of Public Policy for the Immune Deficiency Foundation. She is an accomplished healthcare policy strategist experienced in legislative, regulatory, and private payer advocacy at the state and federal levels. She has been advocating on behalf of IDF in support of the PI community for over 6 years. Christopher Duckett is the Director of Talent Management of IDF and a human resources professional with more than 20 years of experience leading teams in talent acquisition, employee relations, employee engagement, benefits, HRIS administration, and data analysis. At IDF, he manages a workforce of 40 employees and more than 400 volunteers serving the PI community. Welcome, Lynn and Chris.
Thank you.
Thank you, Emma. Okay, welcome everybody. I'm going to share my screen and we'll dive into the presentation. Thank you all for joining us. I know we're getting 5 o'clock. We're into the evening hours on the East Coast and afternoon on the West Coast on a Friday. So again, thank you for everyone being here. I'm going to share here real quick as we get into the screen, and hopefully everybody can see the wonderful starting slide that we've got going here. And I'm going to jump in, and Lynn and I are going to talk together on a couple of slides, and we're going to share a little bit of the presentation here, but looking forward to some questions and answers later, but we'll get started. All right, so I like to start every one of my presentations with the mission statement. I think it's important to remember why we're here. Now, obviously, this is the Immune Deficiency Foundation. I think everybody here is well aware of what we do, but I always like to highlight this part of the mission statement that kind of motivates me as I look at it, and it's that improves the diagnosis, treatment, and quality of life of people affected with primary immune deficiencies through fostering a community empowered by advocacy, education, and research. So on this quality of life part, hopefully this presentation is going to help along with that. And obviously, as always, we're here to help. So any questions you have, we're going to do our best to answer those for you. I don't think we need to go into a lot of detail about primary immunodeficiencies. I think most people here are well aware of what that is. So I'll jump to the next slide. And our goal is to provide accurate and timely information, resources, and support for patients and families. And we are going to touch a little bit on this presentation about how, what we're going to talk about does have an impact on patients, families, caregivers. So this is an opportunity to sort of share that information across, to all aspects of the community. So we're going to dive in. Lynn, I think we were introduced, so I don't know if we need to go into these very much. Okay. So. Yeah. All right, and then here's what we're going to talk about today. So we're going to touch base on the applicable federal laws related to employment. I want to point out as we go into this that we're going to kind of touch base on the federal laws. There are a lot of state level laws that also come into play in some scenarios. It's important to realize that states do have the opportunity in some of these situations to put laws in place that exceed the parameters laid out by federal laws. And we'll get into that when we talk about FMLA, but it's important to know that we're going to stick with the applicable federal laws here. We're going to get into some common terms and philosophies. We're going to take an approach to that of being from the perspective of being a job applicant or an existing employee. What are the concepts you need to know, and for that matter, know how to navigate as you are working, sort of in the world that we live in today with remote workplaces and things along those lines, as well as, we get into the world of accommodations and, working with a disability. So we're going to get into that from that perspective. The employer interactions. I get excited about talking about these things because I've spent, as mentioned earlier, over 20 years of my life working and talking about human resources from the employer's perspective and not so much the employee's perspective. So one of our goals here will be to try to help you as employees understand what you should expect from your employer and not necessarily the other way around. So And then also hoping to give some tips that you never get into those situations where you are at odds with your employer. I mean, this should be a collaborative work environment. There's a lot of things we're going to talk about that should help you to build a good relationship with your employer as you navigate these things. So that's the goal, and that's where we're going to be coming at. Last, we'll have a question and open conversation session. As we mentioned, I do encourage you to ask questions. Even if you have questions that are not really related to the things we're going to cover, by all means, feel free to ask. I've got a question from a previous session about insurance, and if I'm changing jobs, whether or not or I can get the insurance information of the next employer. So we'll talk about things along those lines. So please understand any questions you want to ask at that point, we'll try our best to cover for you.
Yeah, and if I can just jump in, I know we went past our background, but I just, for your benefit, I just wanted to add that in addition to my policy experience, I just wanted to highlight that prior to a lot of the advocacy work that I did for many years, I practiced law working in the disability space. So I do have experience with that, which I want to share my expertise, but I also want to give a disclaimer that any information that I give, I'm not giving, personal legal information, and I'm not hired by IDF to be legal counsel. So I will be using my background, but just want to highlight that that don't take any of this as, individual representation information. So.
Okay. Thanks, Lynn. Good point. Okay. So as I mentioned, we're going to dive into the applicable federal laws. And so one of the first ones is the Americans with Disabilities Act, and I'll let Lynn dive into that.
Great. Yes. Well, a lot of what we're going to be talking about is under the ADA, and we're going to be talking about, as it relates to employment and the Americans with Disabilities Act, which pretty much prohibits discrimination in all aspects of the job journey, the employment journey, from application to hiring to compensation to training and any other privileges of employment. It covers not only confirmed disabilities, but perceived disabilities. We'll be talking more about this later. And it also introduces the requirement that employers must make reasonable accommodations. And again, Chris and I will be talking more about what does it mean to make reasonable accommodations. Your employer, there is an expectation that they have to make modifications and be responsive to your needs, but at the same time, reasonable means sort of that it can't be cause undue hardship for the employer. And we'll be talking more about what does that mean, undue hardship for the employer, and that sort of balancing between making accommodations for you as an individual who has a disability and the employer. And it applies to employers with more than 15 employees. Next.
Okay.
So going a little deeper, when we talk about what does it mean to have a disability under the Americans with Disabilities Act, what they emphasize is that it's a physical or mental impairment that causes substantial limitations on major life activities. And interesting to note that they specifically talk about major bodily functions, including the immune system. So, so PI would definitely fit into this bucket. I know some people maybe don't want to identify themselves as having a disability, but when we define disability in this case, we're talking about whether or not these laws apply to you. And I think it's important that it would cover PI, and so it's to your benefit to be able to say that, a PI is considered a disability. Next.
Okay, I'm gonna go over the Family Medical Leave Act, and I'm gonna be a bit of an HR geek here for a second, because if I'm completely honest, this is probably one of my favorite HR laws. And just by saying that, I feel like I'm a bit of an HR geek. The reason why I've always liked the Family Medical Leave Act is because I've always felt like it was one of those laws that was written that, at least on the surface, is very, very equally divided between the employer and the employee. It was also one of those ones that set pretty clear parameters on how it was to be applied. And I've always thought that this was great. So the thing about the FMLA, though, is it's very often not very clearly understood. So to just touch base on it at a high level, I'm hoping that everybody on this call has at least heard of FMLA. So it's the Family Medical Leave Act. What it does, it provides up to 12 weeks in a year of unpaid leave. And it's the unpaid part. Make sure I highlight that. That's all that the employer is required to provide for a serious health condition. There are some eligibility requirements to be qualified for FMLA. So it's eligible after 1 year of employment and 1,250 hours worked. So it's spelled out that you have to work at least 1,250 hours in that year prior and have worked for a year. And then it applies to employers with more than 50 employees. So it's not every employee, every employer lives under the parameters of FMLA. Now, I'm going to point out again, states have implemented policies very similar to FMLA that may kick in for lower numbers of employees and may kick in earlier than 1 year. They may give paid leave as part of that leave, but FMLA, the greater FMLA aspect, is just simply unpaid leave. The part of FMLA that I think often applies in circumstances for our community, and I think is also very often misunderstood, is that there's a component of FMLA that can be intermittent. What I love about the intermittent leave is that 480-hour block that I've mentioned in the very top means that can be taken in 1 hour intervals if it needs to be. So it can be broken down. And FMLA is not just for the person who has the illness, it's also can be taken by a family member to care for the loved one. And that intermittent leave can also apply to the caregiver. So as long as you hit the parameters of qualifying for FMLA, you can take a small blocks of leave until such time as you have worked through the entire 480 hours of unpaid leave that the FMLA provides to you. Now, to me, I think that's in a situation where if you are a caregiver and you need to take a child, for example, for recurring treatment, then that's protection that you have under FMLA that most people don't realize exists under the intermittent FMLA policies. I think that's a great thing. And it's, again, why I probably geek out a little bit on this one. And even then, as we talked about earlier about the Americans with Disabilities Act as amended, changed a little bit of the way FMLA and ADA interact. And we're going to get to that here in a slide, but I think you're going to find that there's a lot more protections here often than what people think there are. So very excited to get into that.
And I'm going to talk about some of the other laws that are also applicable. And as Chris alluded to with FMLA, all these different laws can overlap and cover some of the same things, but it's important to know that they all come into play. So the EEOC, there's different parts to the EEOC laws, but the overriding protections are that they apply to protected classes and prohibit discrimination of those in a protected class. And the classes include race, color, religion, sex, and sex has been interpreted as including pregnancy, sexual orientation, and gender identification, national origin, age, and that's, I'm feeling really old now, but it's if you're over 40, you can be considered age discrimination. And then in there, the two things that are very important that we want to highlight are disability, which, as we just talked about, can apply to those with PI, and genetic information. And that can also be very important for those of you, where you have genetic information about having a PI, and making sure that you're not discriminated because of that. And that also includes family history. So if there's a family history of PI or other genetic disorders, that's prohibited under EEOC laws. The other one is, the next one I want to talk about is the ACA. That's the Affordable Care Act. And you also may know it as Obamacare. We talk a lot about this, and we advocate strongly for a lot of the coverage protections that occur and that are offered under the Affordable Care Act as part of our IDF advocacy. But it's important in general for you to know that these protect against discrimination related to insurance coverage. And there's actually, they kind of update the regulations associated with that periodically. And this is one of the things that we advocate for, is making sure that sort of some of the things we're advocating now on the legislative side is making sure that there's not discriminatory practices in the insurance design. And that's kind of the things that we work on related to copay accumulators fall into that bucket. But again, it's always important to, if you have an employer, that there's that you have these protections for coverage. The next one is HIPAA, and HIPAA is the privacy rule related to personal health information. And a lot of times this is very much misinterpreted and over broadly interpreted. People think that this means you can never share information about an individual. It is really only about covered entities, and covered entities generally is health insurance and health providers. So your employer, the information that your employer, like your employment records and information, is not covered under HIPAA. There may be some policies and procedures and other, state laws that may cover information that your employer has, but it's, an employer has a right and can ask you, for example, for a doctor's note. And you can't say, well, that violates my HIPAA rules. That it's not. Also, remember, HIPAA, it's the individual's information. So you also can waive that information. If you want your family member to see your medical records, you can waive your and allow whoever you want to see that information. So your employer, if they want to get information about your health, they cannot go directly to your insurance company or to your doctor without going through you, but they can ask for information, and there can be records that that are not covered under the HIPAA rule that your employer has. So just be aware of that. It often is more broadly interpreted than it really covers. So just be aware of that. And then finally, the Rehabilitation Act of 1973, particularly Section 504. This what is a law that, in its title goes back to 1973. It's a predecessor to the ADA, and it really covers federal workers, but just generally any kind of federally funded programs. That's why many of you might be familiar, particularly of children who have PIs or maybe other disabilities where they need some accommodations, and you might have heard of a 504 plan. That falls under that same law. If you work for a nonprofit that gets federal funds, that would be covered. Any kind of program or service that is federally funded would prohibit discrimination, both in the services they provide or to the employees. And but it's very much aligned and with the ADA and sort of a lot of the definitions that are put into the ADA came from this original iteration of the Rehab Act. And that next.
Okay. All right. So now that you've got a good kind of overall working understanding of some of the most applicable laws, and again, very high level, I'm going to get into some common terms and philosophies. And I think these are important to understand as we navigate some of these scenarios. Now, I'm gonna come at this with the approach of, if you're somebody who's applying for a new position, or you're in an existing organization and your situation has changed, whether it be your ability to complete your task or some sort of a health change, but ultimately just keeping in mind that we're looking at this from the employment perspective to begin with. So the first term here is called qualified person. Now, what exactly does that mean? That seems pretty obvious, but there's an actual clear definition for what qualified person is. And in some of these scenarios, you have to be listed or you considered a qualified person for these protections to take place. So the qualified person means you must be able to perform the essential functions of a position with or without a reasonable accommodation. Now, I like to put this out there. If you're currently applying for jobs, if you've actually filled out an application somewhere, or even you've gone on to Indeed, you'll sometimes see this little nugget asked as part of the application process. And it says, can you complete or perform the essential functions of the job with or without a reasonable accommodation? What's key to remember here is if you know what the essential functions are and you are perfectly capable of doing those, then there's no reason to say that you need an accommodation, right? So the answer to that question is yes. Or with or without a reasonable accommodation, the answer could be yes. So are you a qualified person, and can you first and foremost perform the essential functions? What are the essential functions of the job? This should be listed in every job description. If you look at a job description, whether it's one that you have already, one that you're applying for a position, this includes the primary components, responsibilities, or duties of the position itself. They should be very easy to find. If the employer is writing the job descriptions properly, they should stand out. Now, the next part of that is you really do have to understand that you can in fact perform those. So an essential function of the position, if there's a requirement for you to actually be on site to perform the duties of that job, that should be listed in that job description. I was going to use the idea of, if you're going to be a greeter at Costco, obviously you have to be at Costco to do that. If you're a computer programmer, maybe everything can be done completely remote and you don't need to be in person. So those are the aspects that should be very clearly defined in the job description, because it helps later down the road for both the employee and the employer. The reasonable accommodation question. This gets to be tricky because reasonable is a moving target. It cannot cause your employer undue hardship to provide that accommodation. So it can vary depending upon the size of the organization. It can depend upon the number of employees who are in a certain role. It can be moving, a little bit of a moving target, and it's not the same for everybody, but we're going to get into something called the interactive process here pretty soon, and that helps to identify those things. The concept of equal, not better. Now, this is something that again, it involves a little bit of an understanding of what the role actually is, and a little bit of a gut check on, an accommodation may be good for you, but it may be seen as unfair or treating you better, or not equal to everybody else. A great example of this might be if there's a position that requires everybody to be able to lift 50 pounds. It would be treating somebody better to require them to only lift 10 pounds and put all the heavy lifting on the other employees in the same job. That might be treating you better and not equal to everybody else. The goal here is the accommodation is to equal the playing field, not necessarily make one person have an easier or better job than everybody else. So again, not always easy to define, but that's the standard that you're working under.
Yeah, and just jumping in, like an accommodation for that might be that the person, could lift that much if they had some kind of like assist,
Right.
vehicle or something that would help them lift that amount. But it's not just like you don't have to do, the function that is necessary to be done for that job to be done. So there might be a way to make the accommodation that would be equal.
Right. Okay. So one of the things we talked about, what you should expect from your employer, we mentioned earlier the job descriptions. Any position that you're in should have a very clearly defined job description that outlines the essential functions. Now, how do I go about requesting an accommodation if I need to have one? Your employer should have a very clearly defined process to do that. If not, if you're unsure, I would go right to the HR department and explain that you want to know how that process would work. Now, some people would throw that out immediately. Is that a big red flag? Well, that should not be a red flag, because at that point in time, you're simply starting the process of looking into whether or not an accommodation can be provided. And again, that should be a clearly defined process. Go to your HR department if it's not. Quick little heads up on that. As you are looking at this opportunity, you're looking at positions, I strongly encourage you to take that job description, if you have any doubt at all, to your physician. If your physician and you and your physician agree that you can, in fact, do everything in the essential functions of that job, your employer is going to ask you to get information from your physician, and they're perfectly within their right to do so, on what would be a reasonable accommodation. What is something that could help to do that? Your employer has the right to ask about restrictions. So I would encourage you, if you know that you're going to be going down this path, is to already understand what that looks like for you. Go ahead and take your job description to your physician and ask, does this look like something I can do, especially if you're applying for a new spot? And as long as you can, successfully answer those questions, then it makes this process a lot smoother, if you already know what you'd be looking at, or what you would need. So your employer is going to ask for that if you request an accommodation. So might as well go ahead and just get that ball rolling. And your employer has the right to ask for that information. And what they do with that, they should not disclose that. We talked about HIPAA. We talked about this. Your employer should not be disclosing that, other than so far as to actually help to make that accommodation if need be. So if they have to tell your supervisor that you have those restrictions, that's within rights, but it's not something that should be broadcast across the company, and hopefully they would never even consider doing it. But just so you're aware, there should be a level of confidentiality around that information as it's gathered. So I talked about the interactive process, and this is something that both the ADA and the EEOC will sort of encourage organizations to do, and they hold to this. What this means is that if you as an employee are going through the request for a reasonable accommodation, even though, let's say, for example, your request is that you can't work every Friday. Now, assuming that you've got FMLA in works and things along those lines, but let's just say that as an example, you can't work every Friday. Well, if the employer comes back to you and says, nope, that doesn't work for us. Nope, no thanks, we're done. Well, that's not really an interactive process. The ADA says there should be almost like a good faith negotiation between the employee and the employer about how you reach what is a reasonable accommodation. There should be back and forth iterations that go through this. So if I say, for example, I don't want to have to work every Friday, the employer can come back to me and say, well, that's not really realistic for us, but how about we let you take off every Friday from this time to this time? Maybe that works, and then you've come to terms. Maybe it's, well, that doesn't really work for me either. So what I really need to have off is I need to have time every Friday morning for treatment. And they say, okay, well, what do you really need? And can we adjust the day? And there's back and forth, and there's an idea that there has to be the ability for you to try and reach an agreement collectively that works out. It can't just be an ask and a no, or an ask and a yes, obviously good, but it can't be shut down really quickly.
And if I could jump in, I just would say, when you're kind of going through that process and you're asking for some kind of accommodation, tie it back to the disability. Don't just say, I need to get Fridays off, because then without any other explanation, that is better than everyone else. It has to be, because I get my infusions every Friday, and the employer might say, well, how long does it take for you to do your infusions? And maybe it's, it takes 2 hours, but then you may come back and say, but it takes me a little while to recover after I get the infusions. So I would need 4 hours off. That's the kind of back and forth that you could have, but you always have to remember, like, what am I asking for? Why am I asking? And how does it relate to my disability? And if you kind of stick with that and have that reasonable back and forth, you can come up with, some kind of resolution that makes sense for both parties.
Right. And to Lynn's point right there, that's what you're after. And quite frankly, that solves a lot of problems often, is if the approach that you go to your employer with first and foremost is that of one of cooperation and wanting to be productive and wanting to be helpful. Now, I'm not going to sit here and tell you that you're going to get every response you're getting is going to be great that way, but that's the idea. And that often solves the problem when the employer doesn't immediately get put on the defensive of, oh my gosh, I'm going to have to jump through all these hoops. If it's more like, I want to be successful, I want to work, but I'm going to need a little help from you and a little give and take. And you find that you're in the middle of this and eventually you work that out. It comes up to an agreeable situation. I will say this, and I'll say it over and over again, document everything and maintain your records. I hope and can assure you that usually your employer is also. So document everything, document your entire interaction. Hopefully everything works out smoothly, but in the event that it doesn't, you want to make sure you have everything documented.
Yeah, and just one more thing, like with that same example, you might say, well, in the end, if you're getting half a day every Friday, then you're actually in a better position. But it might be that you agree to work longer hours the 4 other days of the week. And so, there's ways to make it so you're not just benefiting without, so there's all different ways of working it through with your employer.
Right. So this next slide, we're going to talk a little about some accommodation examples, and these are just certain things that may pop up or that you could run into. So I thought this was very interesting. One of the things I think that was very positive that came out of am I allowed to say positive that came out of the COVID pandemic?
Silver lining.
It's a little weird silver lining, right? Is that it showed us that people can work from home, and it is actually more successful than I think a lot of employers may have originally thought. So full or part-time work from home has become a more common accommodation. That is something that can be done, especially if it's proven that you were productive during COVID when people were not going into the office at all. I know that a number of offices decided to go back. But again, look at that essential functions of the job part of that job description. And if everything in the essential functions can be done from home, then working full or part-time from home becomes reasonable accommodation. The ability to attend large meetings remotely, if you're in a position that requires you to go to conferences, I think, again, with as many conferences, this one being a great example of that, of things being so readily available and virtual options, that may be a situation where that becomes reasonable to not expect a person to attend large conferences, other than maybe to present if that's a requirement. This is, I mentioned earlier, and I dropped this little hint about FMLA and ADA. So modified work schedule or leave to allow for treatments. One of the things that was interesting about FMLA was it was very hard and fast about the length of time you had and how much availability you had and how much you had to be qualified for, how much time you had to work to qualify for it. Well, the American Disabilities Act that was amended came back and actually made some statements, and then also there's been case law afterwards that says the FMLA, which was a hard and fast thing, may be flexible as an accommodation under ADA. So even though you have to say FMLA said you have to be here for 1 year to qualify, ADA has come in and said, well, allowing somebody to take a leave under FMLA at 11 months might be a reasonable accommodation, considering you probably can't replace that person that fast. They also said, extending a leave under FMLA for another month, provided there's a specific end time, might be an accommodation. So again, there's opportunities here where that interactive process with the employer comes out and comes up with solutions that work out, because again, most employers, I think, would rather hang on to an employee that with a little bit of flexibility than to have to try and replace somebody who's got, let's say, for example, 10 years of experience. Then socially distanced workspace, I think that that's also become something more common, or the support for wearing of a mask, gloves, or face shield. I think that in a situation where maybe your employer has gone away from wearing masks in the office, and obviously supporting your choice to want to continue wearing one would be reasonable. Or for that matter, talking about possibility of socially distanced workspace. If you are in a situation where you share an office with maybe 2 or 3 other people, then maybe there's a way that an accommodation might be to have you in a different part of that building or a different part of that space. Now, it might be perceived, if you're given your own office, that might be better and not equal treatment, but at least having a dialogue around allowing you to maintain a socially distanced space would be reasonable. Now, some questions that we have run into, and these are just not things that have been asked here, but if you have PI, does your employer have to let you work from home? Well, as we've talked about all over here, that really depends upon what the requirements of the position are. So it's not that cut and dry, really. But not really an easy answer, but that's where the interactive process comes into play. My job requires me to be in the office. People don't want to wear masks. Can my employer make it mandatory for my coworker to wear them? That's not really a very easy answer, and it's one that I think has popped up. And Lynn, I think we talked about this. It's just not really been tested legally at this point.
But
So,
I think what I would say is, yeah, it hasn't been, you have to be, well, again, use the iterative process, and there might be other solutions short of making everybody, wear a mask who may not want to, but, there may be, there might be some others in your office that want to wear a mask. So maybe you move around where people's offices are in the office, or, allow you to have a separate office. There's different, it depends on the individual circumstances,
Sure.
The layout of the office. So there's a lot of factors. And I think it goes back to working with your employer. It would probably be challenging for them, at this point in the pandemic to get, to require them to have everybody wear a mask if that isn't a mandate in their own company, which they can do if they choose to. But if it's not, it might be challenging, but we don't, it hasn't been challenged in court at this point.
right. This next question, I have an interview next week. Do I have to tell them about my PI prior to the interview? So this was a question I was asked in a different conference, and the reality of it is, again, if you can answer that question honestly, yes, can you perform the essential function of the position with or without a reasonable accommodation, then there's no need to disclose that. You may choose to, but it's not something you're in any way obligated to disclose if you're not actually asking for an accommodation at the time. It's just like this came up in a different forum was, do I ever at any point in time have to disclose to my employer that I have PI? Well, no, quite frankly, if you're not asking for an accommodation or asking for a leave under one of those state or federal leaves, there's not a need to do that. So that's entirely up to you whether you would disclose it. If you need to take a child for regular treatments and you don't want to lose your job, this was another one that this is where those state leaves come into play. This is where FMLA as a federal leave or state leave plans are there to protect you. And that's typically the family leaves under the different states that would protect you. And I would definitely encourage you to explore those. If you're sick and miss work for a long period of time and I'm eligible for disability, well, this was in reference to the actual different things like short-term disability, long-term disability. Your employer often provides these things, and I would encourage you to explore the thresholds for those. One of the things between like short-term disability, for example, is a quick plug. Short-term disability usually pays if you cannot perform the duties of the job you're hired for. Long-term disability says you cannot perform any job whatsoever. And so there are thresholds on whether those insurances pay out, but I want to just put that plug in there because I think it's something that people often are worried about or concerned about if they get sick, is how they'll maintain their income if they're unable to work. So,
yeah.
Okay.
And I would just, there was a question posed related to one of the earlier questions about wearing masks that where the person said if they want to wear a mask and they feel like they're being bullied by coworkers, there's absolute, I mean, and the employer doesn't want to do anything about it. That's problematic. That would
Very
be
much so,
considered,
yes.
that could be considered a hostile work environment.
Yep.
And it could be on the employer. They really, they do have a duty to protect employees against a hostile work environment, and you would certainly be protected as a person with a disability.
Absolutely, absolutely. And again, it's one of those moments where I would say I would hope that the employer would support the desire for you to wear a mask to protect yourself. So that would not pop up. So a few key takeaways, and I think after that we're going to get into some questions. So prior to applying for a position or approaching your current employer, discuss any work-related restrictions you have with your physician. I think that's very important to know what you are being asked to do in your role, but then also what would be realistic restrictions and accommodations you would even begin to start asking for. Make sure you understand your own specific illness and how it will impact your ability to perform those functions. Again, conversation with your physician. Follow the employer's process for requesting an accommodation and maintain your documentation. This next bullet, negotiate in good faith. I think a lot of times your employer just wants to know. Unfortunately, employers have been handed, lawsuits over and over and over again. And I think the first thing that it prevent them from kind of putting their guard up is to come at that with a good faith saying, be reasonable and demonstrate that you want to be a productive part of the team. And if you're not getting the cooperation, then sometimes you need to get, lawyers involved, but hopefully, it's done very, very well. And your employer comes at that with a honest and a good approach to the interactive process to make that work. And I think I've said, maintain all your documentation. I'm going to say it one more time. Maintain your documentation of all interactions you have with your employer, even emails back and forth. Hang on to all of that information. Just because, again, hopefully you never get to this point, but if you do, you're going to want records of the entire dialogue. Okay. All right. There's a couple of links. I think we're going to have this posted here, but there's a Patient Advocate Foundation. ADA defines someone as having a disability. This is a link to that actual article that actually is, defines a disability. Some job accommodation networks. This is a nice tool to be able to understand what some accommodations are. Enforcement guidelines for Title I of the ADA, and advice on appealing your employer's decision related to accommodations. These are just some interesting articles that I was able to find, but might be helpful to somebody down the road. Okay, I think we're open for questions.
Oops. All right, well, thank you so much, Lynn and Chris, for sharing about navigating the workplace as a person or caregiver to someone with PI. We do have some time available for Q&A, so if you have questions, we encourage you to enter them in the chat box. But before we begin, please remember that everyone's treatment and condition is unique. The information presented during this session is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with questions concerning a medical condition. So we've got some great questions so far. And the first question is, all right, this individual says, I'm 4 years from retirement. My employer doesn't know about my disability. Every month there are forced retirements, and I'm concerned since I'm the oldest in my department that I'm next. Should I ask for ADA accommodations now to protect myself from the early forced retirement? Thinking the disability will protect me and I can ensure I may not lose my job. If I do, may I claim unfair discrimination?
Well, if I can jump in and then Chris maybe can add. First of all, age is a protected class. So they can't force you to retire, but they can make it, they can give, incentives. There are ways that employers do to try to get people to retire. But if it's clear that they're discriminating with you, regardless of your PI, you have protections as being older. So, I think that if you need, to use it strategically, even though you don't need accommodations, I'm not sure that would benefit you, but again, as part of that disclaimer, I'm not giving legal advice. So, I think that there are definitely different types of protections that come into play.
Right. And taking the question at face value, I want to make sure I understood the question right. Was, this person has seen other people been forced into retirement, believes that they're sort of up next, but is asking whether or not they should ask for an ADA accommodation before that happens. I guess the question I would ask first and foremost is whether or not the ADA accommodation is needed regardless of age. So if you're currently doing your job and you're meeting the essential functions and you're able to complete all the tasks and there's not a need for the accommodation to begin with, I don't know why that would benefit you in any way. There's the issue at hand really sounds to me more like it's the age and the retirement. So before anything else. Now, unless there's a component of the job that we're just not missing, and it's a short period of time and a quick question, but I wouldn't go down the path of an ADA accommodation just because we're afraid of something unrelated to a disability.
Thank you both. Chris, we had a couple people asking if you could go back to those links. Maybe we can keep those up while we keep going through Q&A. I think some people were interested in checking those out.
Sure.
Right.
And again, these are just things I was able to find online that were some great, seemed like good resources for the information like this.
Thank you. I think so too. All right, next question. Do I have to deplete all of my vacation time before I can utilize FMLA or before FMLA kicks in?
So I love this question because this is something where the employer has the actual right to sort of set some policy and parameters around that. So oftentimes what happens is the employer works FMLA because FMLA only says it has to be unpaid leave. So what employers typically will do is they'll say, okay, you can have the unpaid leave, but we're going to allow you to use any accrued vacation or accrued sick time to make up the compensation that you're not getting under the unpaid leave. So it's sometimes not so much a have to as it's organizational policy to allow that to happen. Now, another thing that can come into play if you're not taking an intermittent leave or it's not leave to care for somebody else, if it's care for yourself, and I apologize, I'm going to start talking really quick because I think we're short on time. But if it's care for yourself, if the organization has a company-sponsored short-term disability plan, then what often happens is that short-term disability doesn't kick in for 7 days. So the company is going to ask you to use paid vacation or paid sick to cover the first 7 days. Then the short-term disability payment kicks in after 7 days, and then that will run itself out while you're on FMLA. But yes, an employer does have the right to ask you to use short-term disability, or I'm sorry, your vacation or your sick time to cover that gap up to a certain point. Most organizations they're gonna have something in their actual time off policy that defines how that's supposed to work.
Thanks, Chris. And I think we're okay if we go a couple minutes over because we are getting some good questions. First question. Our next question, for states that give paid FMLA, can you still opt for intermittent FMLA and still get your regular pay?
So I would refer you to that specific state because that's going to vary from state to state. So oftentimes the state it's paid leave, but some of the states that have the paid leave, it's not necessarily intermittent leave that's paid. It's usually it can be blocks of time. So I would go, that's kind of state by state. So we would need to get into it. That would be an entire other presentation, quite frankly. And I as much as I'd like to think I'm pretty good in the HR world, I could not sit here and rattle off every single state's paid leave policy. So yeah, sorry, but I think that's one we'd have to look at case by case.
Sure thing. Thank you. All right, next question. Regarding HIPAA and workers' comp, if you are injured on the job in a fashion unrelated to your underlying PI conditions, is there a way to not disclose all those underlying issues, but still go through with the workers' comp process?
So I think some of this is going to be dependent upon the actual injury itself. So if you have PI, but you trip and fall at work and injure your knee, and it's completely unrelated, the questionnaire, though, I'm trying to remember exactly what's asked in a workers' comp questionnaire, but typically they're not going to get into, unless it actually had a direct impact. Now they could get into the idea of any medications you were currently taking or anything that you were on at the time of the injury, because they're looking to determine whether or not that there's any sort of medical or any sort of drug-related component to the injury. But I think that it's in some ways possible to get into that without disclosing it. But let's say, for example, you did, the only people who should have then gained knowledge of that information would be the people who actually handle and process the workers' comp claim, which would be a very small number of people within your human resources department. And again, that's something that should be kept and remain confidential, that should not be disclosed outward unless absolutely required. So yeah, I guess it's a depends kind of answer, but I would anticipate that any information that needed to be disclosed would be maintained very confidentially by your HR department.
Thank you. All right, and I think this will be our last question for this session. This individual says, I have been granted a temporary reasonable accommodation, but my employer, who's a state government entity, has a very passive aggressive approach to me and also keeps requesting very lengthy documentation from my doctor and myself very often. It has become very time consuming and very stressful. How often is it normal to submit all of the medical documentation?
Okay. I know that, and again, this could be something that's state specific, but I do know that under FMLA, it's reasonable for, and this is not an FMLA question, but under FMLA, you can request medical certification every 30 days. So in this situation, it may be similar. Yeah, I'm gonna answer a question that wasn't asked just because it came up in a previous forum very quickly. There was a question asked during the insurance presentation about if I'm changing jobs, how do I ensure that the formulary where I'm going to will cover what I need to cover? I think you'd find that during the recruiting process, most of the employers that are interviewing are perfectly happy to talk about the benefits coverage they have, because I think every employer sees that benefits coverage is part of their total compensation package. So they want to know that as an employee coming in. I think it's reasonable to ask for that, and I don't think you'd have any harm in doing so. So just for what it's worth, that was something that came up earlier. I want to make sure we had an answer to. And if there's a question that's asked, I apologize, and somebody wants to put that in the Ask IDF forum, I'm more than happy to take that away and do a little bit more research on it so that we could maybe get an answer. But I want to make sure we are careful that, to Lynn's point, we're not offering legal advice, but I'd be happy to do a little research if I could.
Awesome. Well, thank you. I think that was a great last addition for our Q&A. All right, so thank you so much, everyone, for being a part of this important session. Our time together is coming to an end. Thank you so much to Lynn and Chris for being a part of this session as well and for leading this great conversation. It's been such an honor to have you join us today. And we hope everyone has a great rest of their evening and enjoys the rest of the conference. Thank you so much.
Thank you.
Thank you, everybody.
Thanks, Emma, you did a great job all day.
Thanks, Emma.
Thank you.